Wendy, when were you started to be told, or when did they tell you that you had or that you could have chronic pancreatitis? What were the symptoms that you were having that led to this diagnosis? And if you recall, how was the diagnosis made?
In 2003, at this point, I had probably about 4 episodes of pancreatitis, and that landed me in the hospital. And when I saw Dr. Gordon, he did a CAT scan, and it showed that I had chronic pancreatitis. And then that was when I first had my first endoscopic ultrasound, which showed symptoms or signs of chronic pancreatitis, scarring and episodes of where I've had numerous attacks of pancreatitis. They did, again, blood tests that confirmed that my amylase and lipase was elevated. They did an ultrasound of my gallbladder to, again, rule out gallstones. I did a barium swallow at this point to, again, check and see if there was something else, an underlying cause for my pancreatitis. Still not finding any real reasons for it. They just put me in the hospital, gave me fluids, kept me without eating and drinking, and when the symptoms relieved themselves, they sent me home until...
So they were not able to really pinpoint to exactly why you were getting the pancreatitis.
Correct. Right.
So I'm sure you heard the word idiopathic.
Yes.
We have looked for everything and we can't find a reason.
Right, yes.
Perfect. Tina, how long did it take for your doctors to tell you that you were having chronic pancreatitis? What symptoms were you having?
Well, that was what Dr. Gardner had told me that I had. Because when I first started seeing him, he put me in the hospital and did testing, and I don't know when they do the levels what that goes up to or anything like that. So, but he had said it, and then at one point, I just couldn't keep anything down and all that, and that's when he said we're putting a feeding tube in. So I was monitored from Dr. Garden, for every month I would go.
Very good.
Some of the symptoms that I was having was, again, the pain in the middle of your abdomen that radiated through to your back, and the nausea, the vomiting, diarrhea, all of those same symptoms that I had when I was first diagnosed with acute pancreatitis.
And you were having pain all the time, or
Yes.
were you pain-free at any moment?
I was pain-free in between, but then again, each time I landed in the hospital, the pain would last several days to up to a week. And when I was diagnosed with the chronic pancreatitis, it started to linger longer for periods of times, for weeks at a time, for months at a time. Or it would come and go. It would be like a stabbing sensation, and then it would disappear, and then it would come back, several days later, and stuff like that.